Welcome to Orthopod, a podcast about the people of orthopedics and their stories. We understand that we all play many roles in our careers and lives, and it is these very stories that ultimately inform our successes and failures. Welcome to another episode of Orthopod. Today in studio, we are going to be giving the world premiere findings of the multi-year, multinational hip attack trial. And we're going to get you filled in all about that trial. But let me just introduce my first guest and friend, Flavia Borges, who's an assistant professor of medicine at McMaster University, and also is, luckily for me, the co-lead of the hip attack trial. And she's going to give us a little bit of an update about the methodology of this trial, and we'll get into the results with another guest, Dr. PJ Devereaux, very shortly. Let me also just remind everyone here that we are going simultaneously live at the time that the main presentation at the Orthopedic Research Society, Sunday, February 9th, 2:30 p.m. roughly, will be presented, and the results will be presented in concert with a expedited publication of The Lancet. So it's another one of these world premieres that we're really excited at Ortho Evidence and Orthopod to be able to share with you, our membership. Welcome, Flavia. How are you?
I'm good. Thank you. It's a pleasure to be here.
It's a pretty exciting time for this trial. So just remind me again, how long has this trial been part of your life?
Of my life?
Yeah.
Okay, my life for the last 4 years and a half.
Right.
Yeah.
And it's been a pretty big undertaking. So for you, it must be particularly special to be having it now closing out and really being on the last few days before you present it to the rest of the world.
Yeah, for sure.
That's pretty exciting. Okay, so do you want to just give us and our viewers a bit of an understanding of the methods of the hip attack trial and really what the hip attack trial set out to do?
Sure. So, well, we all know that hip fractures is a big healthcare problem.
Right.
And the outcomes on these patients are pretty bad in terms of high mortality and high clinical complications in 30 days, 90 days, and even a year after the fracture happens.
Right.
And in the last few years, we don't have any major interventions that are changing the outcome of these patients.
Right.
And the idea of the hip attack trial based on previous observational data that show that early surgery could possibly improve patients' outcomes was to build the first large international randomized trial to address this question, if the accelerated surgery pathway could really improve patients' outcomes as compared to standard of care.
Got it. So then the specific research question was accelerated surgery to what timeline versus what time? What were the general comparisons you were interested in? What was the outcome?
So our goal was to expedite surgery as soon as possible, but our major goal was to try to reach the OR within 6 hours from ortho diagnosis in the accelerated care pathway, as compared to standard of care that is usually 24, 48 hours.
Got it. So just again, the accelerated group was 6 hours from the time they get diagnosed with a hip fracture and emergency right to the OR with a surgical fixation of some sort, right? And that was left to the surgeon's discretion, right?
Yeah.
Outcomes of interest were?
So we had two co-primary outcomes.
Right.
The first one was all-cause mortality.
Right.
And the second co-primary outcome was a composite of major complications, including mortality and non-fatal myocardial infarction, stroke, major and life-threatening bleeding, sepsis, and venous thromboembolism, which would include pulmonary embolism, proximal deep venous thrombosis.
And the time point at which you were collecting this information was?
90 days.
90 days. So the 90-day primary outcome. And you followed patients beyond that as well?
We are. We are still following them.
Yes.
We finished recruitment last May 2019. So up until May this year, 2020, we will then have the complete 1 year follow-up for all patients.
Superb. And so can you just remind us again how many investigators were involved? How many countries broadly? This was a pretty big, complex trial.
Yeah.
And how many patients ultimately did you recruit? Yeah.
So we have ultimately 2,970 patients included.
Wow, that's massive.
Yeah, across 69 sites in 17 countries.
So 17 countries, 69 sites. Wow, that's quite a feat to get all that information in. Okay, so were there any other important issues of study methodology that you think it's important for our membership to know about before we unveil the results?
So I think the big challenge of HIPAA was really to build the accelerated care pathway.
Right.
So it was a multidisciplinary team effort in terms of having the accelerated care, not just to reach the patient in the OR in a reasonable time frame of 6 hours, but also to involve medicine, cardiology, and anesthesia to clear those patients to be on the OR in a timely fashion, in a safe way as well.
Right. And initially, I imagine there was quite a bit of pushback in getting that done. But did you find that after time, getting patients to the operating room quicker turned out to be fairly reasonable and fairly standard for most centers once they had gone through the process?
Yes, for sure. And even for a patient's perspective, we did all the patient engagement research parallel with HIPAA. And from patient's perspective, they were willing to be in the accelerated care. And then for emergency room was good because then the patients would leave the ER earlier.
Yes.
And then they would reach the OR earlier. And we had all the physicians involved, and as soon as they realized that was better for the patient and better for the whole team in terms of optimizing the care, there was no pushback anymore, and our recruitment ramped up with the time.
So it did very well. Okay, great. So just to remind everybody, we are, this work is being published simultaneously as it's being presented at the Orthopedic Research Society in Phoenix, Arizona. Flavia will be the lead presenter along with Dr. Devereaux, and the paper will be coming out at the same time in the Lancet as an expedited paper. So we'll certainly in Ortho Evidence be posting some summaries, and we're also going to get a number of feedback from a number of other investigators as we move forward. But I want to thank Dr. Borges for taking time to come in on under a busy schedule. I really appreciate it, to give us this information. And we look forward to hearing the results. I can't wait.
Wonderful. Thank you. Thank you so much.
Thanks for watching Orthopod. Stay tuned for more episodes.